Okay, we're going to be examining Harmony's nose and mouth today. So first, I'll be starting with her nose, just looking visually for any lack of symmetry in her nose septum, any other weird deviations, colors, or bruising or anything like that. And then I'll be looking inside of her nose, observing mucosa and the turbinates as well as the septum. So I'll be using this little otoscope little guy here. So I will be going like this and looking in there, making sure everything's okay. Other side as well. There we go. So looking at that, making sure that everything is good in color, the mucus is good, there's no bleeding or anything like that, any nodes or tumors, anything that I noticed in there. And then I'll be going on to Harmony's lips. So I'll be looking at her lips, making sure those are good in color and moisture, not too scaly or anything like that. And then we'll be going into Harmony's mouth. So I'll have her open up her mouth, and while I'm doing this, we'll be observing saliva and halitosis, any poor smell with that. And I'll be first looking at Harmony's tongue, making sure that's good in color, looking at the edges, observing for any jaggedness there, anything growing on the tongue, if the color is weird or off, anything from pink. And then you can continue, open your mouth for me, please. And I'll be observing the sides, her cheeks, the sides of her mouth. Good, and checking.
Do you want to use a pen light?
Yes, I do want to use a pen light. Thank you. Thank you. So, perfect. This will help. So we'll be observing that. And I see a little linea alba on her cheeks, and that's fine. So we're looking at that, and then we're also looking up. I'll have Harmony lift her tongue up, so I'll be observing the frenulum underneath her tongue, also the floor of her mouth, and then we'll be looking at the roof of her mouth, making sure that that looks okay in color and everything. We'll be observing the teeth, making sure those are good in color, and I'll be, where did I put my, I'll be taking the tongue depressor, and we'll be looking at Harmony's gums. So we'll just gently tap on, can you open your mouth for me, please? And we'll just gently tap on the bottom gums and the top gums, making sure there's no bleeding with that. I'll have you stick your tongue out, and I'm going, and you can open your mouth, sorry. And stick your tongue out for me, say ah. Good. And I'm making sure that Harmony's soft palate and uvula is raising and falling together. And then we will go on to, I'm just gonna take some cotton and just to move Harmony's tongue around, just to make sure. Can you stick your tongue out for me, please? And open your mouth. And I'm just gonna move that around. This will give me a better view inside of your mouth. Do you have anything left on your tongue?
Nope.
Okay, there you go. Just making sure I can see everything, every part around the tongue in case I missed anything. And then I will be going on to, I'll have you take your glasses off for me, please. And we'll be going on to nasal patency. So I'm going to depress on your maxillary and frontal sinuses, and you just let me know if there's any pain with any of that? Any pain with that?
No.
And then frontal?
No.
Any pain? No. And then we're going to gently percuss. Any pain?
No.
And then over her maxillaries.
No.
I'm making sure there's no pain with that.
No.
And then last but not least, we're going to check, and I've seen this already, but cranial nerve number 12, when you stick out your tongue, it seems to come out straight, but we'll check that again. There you go. Come straight out. So good there, cranial nerve number 12. And then 9 and 10, we're going to do the gag reflex. So I'm going to have you open up your mouth for me, please. And I'm gently going to tap the back of your throat and making sure that Harmony has a gag reflex. And that's it.